Hello, my name's Roxy Blackburn, and I'm going to talk to you about how to recognize and manage nurse incivility. After watching this video, you will be able to define incivility in the workplace, explain why it's important to address nurse incivility, give it at least one example of a common form of nurse incivility behavior, and at least one verbal strategy for dealing with incivility. Nurse incivility is defined as low levels of rudeness in the workplace that undermine nurse collegiality. Why is this so important? Well, research has shown that more than 85% of nurses have reported that they have been experienced nurse incivility in the workplace. One Australian study of more than 6,000 nurses found that almost a quarter of them considered leaving their jobs because of nurse incivility, and about 3% considered leaving nursing altogether. So why is addressing incivility so important? Well, in 2008, the Joint Commission issued a Sentinel event alert saying that disruptive behavior in the workplace undermined a culture of patient safety. Every year since 2008, the Joint Commission has mandated that hospitals address codes of conduct in the workplace and have zero tolerance for intimidating behaviors. Workplace incivility also presents patient safety issues in increased patient errors, medication errors, patient falls, and reductions in patient and nurse satisfaction. Addressing nurse incivility is also an important criteria for most of the credentialing organizations, such as the American Nurse Credentialing Center, which gives Magnet accreditation and Pathway to Excellence, as well as the American Critical Care Nurses Association, which in their Beacon Award. In 2004, Naomi Griffith wrote a paper that described the most common forms of nurse incivility behaviors. They're listed on this slide. Now I'm going to demonstrate through role-playing how you can handle each one of these incivility behaviors in your workplace. Each of these responses is also listed on the handout that I'm providing. Okay, nonverbal innuendo is unkind face making. Let's look at how this occurs during shift report. Hi, Chrissy. So the patient I was telling you about still needs 2 units of blood. She needs 2 potassium runs, and because she was gone to dialysis all day, she's also going to need her dressing changed. Chrissy, I can see by your face that you have something you want to say to me. Do you want to talk about this right now? Verbal affront or snide remarks are also common incivility behaviors that we see during shift report. So Chrissy, the patient still needs 2 units of blood, 2 potassium runs, and because she was gone to dialysis all day, her dressing also needs to be changed.
Sounds like incompetence. Whatever.
Chrissy, I learn best from people when they just talk to me about what the problem is. Can we talk about this right now? Undermining activities such as turning away or not acknowledging are behaviors that often occur throughout the day. Sure, just a minute, I'll get that for you. Chrissy, would you mind answering 1178's light while I get this nausea medicine? Chrissy. Chrissy, help me understand what's going on here, because I called you and you didn't talk to me, and I understand best when I actually am able to talk about what's going on. The 4th most common incivility behavior is withholding information, and this can be about practice or patients. So let's see how this works. Chrissy, I've never done tracheostomy care, and I need some help. Could you show me how to do it?
Yes, I could show you how to do it, but why don't you just go look it up on Mosby's online?
Chrissy, you have valuable information that I need for patient care. Can we please work together so that we can provide the best patient care today? Now let's see what sabotage looks like. Okay, I need this, I need that. Yeah, I need suction tubing. What happened to my supplies? Where did everything go? Chrissy, there's more to this situation than I thought. Can we talk about what's going on here? Infighting or bickering is very non-professional. The response should always be to stop and walk away.
This assignment is a mess. Why am I getting the first submission?
Chrissy, this is not the time or the place. There are patients here. We'll talk about this later. Scapegoating is attributing everything that goes wrong to one person.
Every time she's in charge, I get the worst assignment with the worst patients, no supplies, and my day completely and totally sucks.
Chrissy, I don't think that's the right connection. The last three behaviors, backstabbing, failure to respect privacy, and broken confidences, blur the lines between venting about one's frustration and just plain gossiping. As nurses, we often complain about others who didn't get their jobs done. But back in second grade, we all learned that these kinds of behaviors were not allowed on the playground. And the best response is to indicate that we're not comfortable talking about this.
Debbie on the night shift is stupid, lazy, and careless. Last night, she didn't even total up her I&Os. And then she forgot to tell me that the patient's scheduled for CAT scan this morning. I heard she might even be reported to peer review for all of her mistakes.
Chrissy, I'm not comfortable talking about this, and I'm not comfortable talking about her when she's not around. So can we just drop this? So in conclusion, nurse incivility is defined as low levels of rudeness that undermine nurse collegiality. It leads to patient safety and satisfaction issues. And the common forms, again, are nonverbal innuendo, verbal attack, scapegoating, undermining activities, sabotage, withholding information, backstabbing, and failure to respect privacy. And so now I'm going to ask if there are any questions. And on the last slide are some citations or references that you can look up if you'd like to look up more about nurse incivility. Thank you.